begin with Smart Body Physical Therapy. Laura Bunso-Bittencourt joins us now. She's the president of the company, and this is a very unique type of physical therapy place. Tell us a little bit about it, Laura.
We are very different. We specialize in pelvic health, and that means women's and men's health.
Okay.
We are specializing in the low back, pelvis, vaginal, and rectal muscles.
Okay, and when we're talking about this, I don't think really a lot of people understand, but sometimes we're talking about postpartum. Once you've given birth, there's some things that may not work exactly like they did prior to that.
Right.
Tell us what might go wrong or what you might see.
Well, there's a long list of things that can go wrong, but there are a lot of things that are really common. But just because they're common doesn't mean that they're normal. So you can have pain with intercourse, you could have urinary leakage, you could have low back pain, neck pain from nursing the baby. There are a lot of different musculoskeletal issues that typically go unaddressed because women, usually we're just trying to do everything we can to keep up with this newborn and take care of ourselves. But most of the time, these things can be treated with physical therapy.
Okay, let's talk a little bit about the incontinence that can happen, because oftentimes it can happen to women as early as in their 20s, once they've gone through having birth, whether it be vaginal or even a C-section.
Exactly.
Because just having the baby with all that weight down there. Also with a C-section, oftentimes people don't realize this, but to get to the baby, they have to literally physically move the bladder out of the way. So that's part of what can happen as well.
Right, just generally trauma to the pelvis is going to contribute to urinary leakage. You could have urinary leakage, it's incredibly common even if you haven't had a baby, but having trauma increases your risk of it, and with vaginal and or C-section, but we want to rehabilitate those muscles.
Right.
Just like we would rehabilitate your knee or your shoulder if you'd had an injury, and we are hoping to increase some awareness about the care that's available for women postpartum, because we would love for women, just as a standard of practice after you go back to your OBGYN, 3 weeks postpartum to come in and have a postpartum evaluation.
Okay, these things can all be, like you say, they can be rectified. So this is a muscle toning issue, or what might one do to get things back in order down there?
Well, it's not always weakness. Sometimes you'll hear people talk about doing Kegels or strengthening exercises for the pelvic floor. A lot of times that is a good way to go, but sometimes it's more complicated than that, and it has a lot to do with coordination, voiding habits, and some other things that we would do for training with these particular patients.
Okay, and so some of these things are very common, which is interesting, and like we were talking before, many times women don't realize this, or not until it becomes such a problem that maybe a year into it, they could have had this fixed a long time ago.
Right, we think that it's just a part of the suffering of being a mother. You know, we just think that, okay, we have our beautiful baby that we love so much, and just be glad that they're healthy and they're here. But just because it's common, it doesn't mean that it's normal, and you absolutely can have improvement in these things. And our body has what it needs to help heal. We just sometimes need some guidance to rehabilitate it.
Right, and this is what you brought along. This
yes,
is a model
this is the pelvis.
Okay.
We are seldom without one, and we usually use it in the clinic a lot. But what I love to show my patients, and before we do an evaluation with the patient, we'll typically show them what's happening with the pelvis. But this is the pubic symphysis here, the pubic bone, and these red areas here are all striated muscle. That means it's no different than your bicep or your quadricep. So if you are going to go to the gym and work out, you can see those things in the mirror. But when we're talking about the pelvis, you can't see if I'm contracting my pelvic floor or not right now.
Right.
No one knows. I'm the only one that knows if I know how to do it well.
Right.
And because this group of muscles is so hidden, that's where our specialized equipment comes in, and that's the biofeedback equipment, and it allows us to visualize it on a computer screen, a lot like an EKG would let you see what's happening with your heart.
Gotcha. But while we have it, let's just turn it this way for a second. Is this the bladder right here?
The bladder is here, and the uterus is here, and it's all sitting a little higher than it normally would. It's hard to get back in there.
When you have a baby, it's sitting on all that weight is there pretty much all the time. Talk about the biofeedback that you have available. How does that work?
Well, it is done just like with an EKG, how you'd have a little electrode set on your heart. You have little like stickers on the outside of the vagina or the rectum if it's a male. Sometimes we use a little sensor in the inside, almost like a tampon, but none of it hurts. And you would see it's connected to the computer screen, and then you can see on the computer screen exactly what's happening with your muscles. So it lets you visualize it, and then you can hear what you're doing. It gives you a tone. There are a lot of different programs that we can do with it, but it's just amazing. And so many times women walk out of there and go, I had no idea that's what I was doing with that group of muscles.
So it could just kind of teach you to squeeze and get things.
It gives you feedback, live feedback on whether or not you're doing it correctly. Because a lot of women know that they should be contracting those muscles, but they don't know if they're actually doing it correctly.
Very interesting. We don't get to talk about this stuff very often. So, you know, this is
all
great.
this taboo stuff.
I love
we hope that everyone starts to talk about it more.
Well, I think it's great. And I think what we've done now is at least open up the conversation. If you're somebody at home that suffers from something like this, give them a call.
You can call us directly. You don't have to have a 5 You have direct access. And then we have onesies. Can I show you guys the one?
Show us a onesie and then we got to go.
Yep. So first 5 callers, I think it is, that get a free onesie.
Oh,
yes.
good.
Yes.
All right. Listen, thank you so much.
Thank you. Appreciate it.
It's always great to have you.
Thank you, Karen.
You bet. Up next, Orange Park Medical Center.